Hello, welcome to Smartness tutorial once again. Today we have another important section from the previous. We are going to continue from the previous lesson that we did on peptic ulcer disease. Do you know that there are differences between gastric ulcer and duodenal ulcer? Yes, but most of the time, what do we see? Patients are being diagnosed of peptic ulcer disease. So it is important that as nurses, as midwives, doctors, pharmacists, we understand the basic differences between the two main types of peptic ulcer, which is the gastric ulcer and the duodenal ulcer, and that will help us to be able to counsel and educate our patient to have a better lifestyle. And so if you have not subscribed, please subscribe to the channel, share, and then give a thumbs up or comments at the comment section. And so to be able to understand the clinical differences between these two types of ulcer, these features will help us to understand the various differences between these two conditions. And so let's look at the location of the pain, or the location of the ulcer. Sorry, the location of the ulcer. The location of the ulcer. So with the gastric ulcer, mostly it occurs at the lesser curvature or the pylori, the lesser curvature of the pylori. And then this one, it mostly occurs at the first part of the duodenum, which is the bulb of the duodenum, and that will be shown on the screen. Now, the description of the pain. And so with the gastric ulcer, this pain is usually sharp and gnawing. And then with the duodenal ulcer, it is dull and also gnawing. Now, let's look at the timing of the pain. At what point in time do patients with gastric ulcer experience the epigastric pain, and the patient with also duodenal ulcer also experience the epigastric pain? Now, with the gastric ulcer, most of the pain is worsened by meal. Worsened by meal. Usually 30 minutes to 1 hour during meal time. And so when the patient is eating, usually around 30 minutes or after about 30 minutes to 1 hour, that is when they usually experience the pain. And then the duodenal ulcer pain worsen after meal, usually 2 to 3 hours after. And so with patients with duodenal ulcer, normally they complain about this epigastric pain after they have eaten, that is about 2 to 3 hours after meal. Now, why does it happen so? Because when the after digestion in the stomach and the food exits into the duodenum, the pylorus briefly closes, and that prevents the acidic content from the stomach to enter into the duodenum. And you know that acid also gets into the duodenum, will also exacerbate the pain. And again, the food substances that have been digested and then being sent into the duodenum are also alkaline in nature, and that will help to soothe the ulcer within the duodenum. And that is why normally patients with duodenal ulcer do not experience pain during meal time, but rather after 2 to 3 hours of meal. Then now, let's look at which of these patients will be waking up from bed by the ulcer pain. And so we said that in duodenal ulcer, patients experience pain after 2 to 3 hours of meal. And we all know that when you are sleeping, you are not eating. And so during that moment, the patient is not getting this alkaline substance into the duodenum, and that means that the patient is going to experience pain. That is what duodenal ulcer. And so nocturnal pain, that is night pain, okay, when they are sleeping, they usually experience the pain. And so patients with duodenal ulcer usually wake up from bed because of this nocturnal pain. But patients with gastric ulcer, no nocturnal pain. Then now let's look at what usually relieve them of the pain. What usually relieve them of the pain. And so when we talk about in terms of meal, and so that means that with the gastric ulcer, patient is not relieved by meal. Okay, so not relieved by meal. And then with the duodenal ulcer, they are usually being, the pain is usually what relieved when they are eating. So relieved by meal. Now, and so if we say that pain gets worse in gastric ulcer, that means that patients with gastric ulcer will always not feel for food, and so there is always what anorexia. There's always anorexia in patients with what gastric ulcer, because we said that their pain is always worsened by meal or when they are eating. And then with the duodenal ulcer, because their pain is usually relieved by meal, they will always have the appetite to eat. So they always crave for food. Now, and so when a patient is having anorexia or loss of appetite, it can also affect the weight. And so that means that gastric ulcer patients will usually, so let's look at their weight, the features here. So that means that this patient will always have weight loss, unexplained weight loss. And then since this patient, their pain is always relieved by meal, they will always have the appetite to eat, and that will increase their weight. So here we have what? Weight gain. Weight gain. Now, another clinical feature which also distinguishes between these two is vomiting. So in gastric ulcer, because the presence of food in the stomach worsen the pain, the body will always try to get rid of it through what? Vomiting, and that usually help them to be relieved of their pain. And so vomiting is common in gastric ulcer, where in duodenal ulcer it is what? Less common. Vomiting is less common. Now, in terms of their, so with the vomiting, what will be the content of the vomitus in terms of gastric ulcer? Now, because the ulceration is happening within the stomach, and there can also be oozing of blood, with gastric ulcer, there's what? Blood in vomitus. So we have another here, the excreta. So here we have what? Blood in vomitus. And then when we get to the intestines, it is about what? The feces. Okay, and so this one also, we also have what? Blood in stool. Blood in stool. Now, there is also another clinical feature in terms of their blood group. Research is saying that patients with gastric ulcer are mostly people with blood group A. And so gastric A is here. So always when you remember gastric is talking about blood group A. And then duodenal, we also have another letter which is what O. And so duodenal ulcer is mainly affects people with what blood group O. And so these are some of the few clinical differences between gastric ulcer and then duodenal ulcer. I believe this video has helped you so much to understand the differences between these two conditions. If you have not subscribed yet, please subscribe, comment, and share this video. Thank you very much.